Hey everyone, this is Josephine Loren, the co-founder of Incest Aware. Thank you all for showing up today to view our Outspoken series. Today we are here to talk about intersectionality, and I've brought some awesome friends and fellow activists along into this conversation with me. Kidra, do you want to start by introducing yourself?
Of course. Hi, everyone. I'm a member of Incest Aware Alliance and one of Joe's favorite people. She did not say that, but I am coined as one of her favorite people. And I'm just excited to be in a space where we are activists, we are advocating in a voice for those who have had lived experiences like some of us or being around it. I'm in the mental health space, do a lot of speaking, coaching, publish books just on my own experiences and being a voice for those who may not have a voice right now. So that's me, and I'm excited to be here and excited for our conversation today.
Awesome. Popcorn Kiki.
Hi, I'm Kiki Saragnese. I am a social worker and, excuse me, and a preventionist based in Kansas City, Missouri. In my professional sphere, I serve as a director of prevention and outreach for the Missouri Network Against Child Abuse. Um, and I am really excited to be here, have these conversations with this amazing group of folks.
Thanks so much for being with us. Popcorn Ethan.
Hey everyone, I'm Ethan Levine. My pronouns are he, him. I've been connected with Incest Aware for about 4 or 5 years. And also, I've been in the anti-violence advocacy space for a long time, but this is the first organization I've ever worked at that like directly even acknowledges that this is supposed to be part of our broader work. And I used to do this work through direct service and like prevention and outreach. And in more recent years, I've really shifted into the kind of research and evaluation, seeing what the impact of our work is on us as providers or activists, and also on the folks we're serving side of things.
Thanks so much for all of the time that you've gifted to Incest Aware and mostly for our friendship. Kiki, why don't you start us off by just what is intersectionality?
This is a delightful question, and I'm always excited to have an opportunity to brush the dust off of my women's and gender studies degree. See, people said I would never use it, and look at me right now. Um, so intersectionality is a really fantastic term that was initially coined by a critical theorist named Dr. Kimberly Crenshaw. And Dr. Crenshaw was looking for a way to describe what she was seeing in the community around her. And she specifically was looking at this was during kind of the crack epidemic, and she was specifically working in the legal space, and she was looking for a way to describe the way that she was seeing Black women being punished and experiencing the criminal justice or the criminal punishment system differently than white women. So she coined this term intersectionality to describe the intersections of identity that all of us, live in and operate in. And in her initial writing, she was specifically using that term to talk about the experiences of being Black, of being a woman, of being criminalized, of being a parent and a mother, of being in relationship and being in communities that were criminalized during this period, the geographic identity. And so using those to understand that no one is experiencing just one of these things at the same time. We're all living in multiple identities at once. And Dr. Crenshaw used intersectionality to talk about that. Um, Ethan, do you wanna piggyback add on?
Yeah, I love that. Also, quick shout out to all of our women gender sexuality scholars and students because like it's everywhere. It just I feel like it's just part of patriarchy to tell you that that's not important. So just love that. But yeah, that was so beautiful. I guess just a couple of things I would love to add. Like, there's one case that I've seen Kimberly Crenshaw talk about um, that I think really brings a lot of that together, which was an employment discrimination case, right, where a Black woman had applied to a job at a factory, not been hired, and uh, filed an employment discrimination case. And the judge said, you couldn't have experienced sexism because this place hires women. You couldn't have experienced racism because this place hires Black people. And even if you don't know the story, you know where it's going, right? And that, like, those things were true, but all of the women hired were white women, all of the Black people hired were men. And So she had a reasonable claim, but there was no legal framework that would allow her to do that. It was considered unfair or too much to make a combined racism sexism claim. So this was just like imperceptible in the law. And so again, I think Kiki gave an explanation of what intersectionality is doing. So beautifully for that. But yeah, the one other thing I will add is that and this comes up a lot in my teaching, like I'll sometimes assign like a video of Kimberly Crenshaw, and then I'll have students read something from before she was working in this space, and students will be like, "Oh, wow, like the Combahee River Collective in 1977 was totally talking about intersectionality. I wish they had read Kimberly Crenshaw first." And so, like this was a part of Black feminist thought, scholarship and advocacy for a long time, but we get this beautiful word for it in like the late 80s for Kimberly Crenshaw.
Mm-hmm. Yes, thank you for bringing us back to that history. Shirkydra, you have such a breadth of experience as a survivor, as an alliance member, as a an engineer in the Navy, as a sexual assault advocate in that space. How have you seen or experienced intersectionality specifically within the issue of sexual violence?
I think it goes back to what Ethan just described. I remember that case she said, like, to say that it's complicated is an excuse to do nothing.
Hmm.
And I would couple that with the space that I'm in, where it's like, when you see somebody that comes from a different ethnic race, gender background not get penalized versus if someone look more like me will get penalized for something, and so many people do not feel protected due to that. Being in a space that's high in politics, high in rules and regulations, but still coined for a certain group of people, even though there are so many different I think we've come a long way, and sometimes it's sad to say we still have a long way to go. And so we see that sexual violence is still happening, still unprotected, but now it's just beneath layers of there's no voice for it now. So it's not that we've reduced it, we've just put things in place to where, oh, nobody's going to know about this until this person retires, and they will have a voice when they retire. They will have a voice when they take the uniform off. Sometimes it just reminds me of, growing up in a low income, what people say the hood, and looking at some people never know what happens until you leave this place, because this place sometimes makes it like, oh, that's normal, oh, that's okay. Then coming into a uniform place that says the same thing. It's like, man, you're constantly being like choked or sometimes feeling muzzled based on the environment I'm in that says, hey, because of whether it's gender, whether it's race, whether it's sexuality, that based on the environment, I do not have a voice in any of these spaces.
Yeah, that's exactly right. Kiki, what have you, either personally or professionally, how have you encountered intersectionality in your life?
Yeah, I I really love the anecdote that Ethan shared about students reading these works and saying, "Wow, I wish they had read Kimberly Crenshaw," and say, "Hey, we knew this, right? We just didn't have the word. We didn't have the shared language." And I think like I said, right, I did my little women's and gender studies degree, and I loved every second of it. And I felt, I think to borrow from Bell Hooks, who said, like, I came to theory because I was starving, right? I was seeing and feeling all of this stuff around me, but I didn't know how to explain it. I didn't know what it was called. I didn't know that everyone else was feeling this way too. And so I think this happens to folks sometimes when they go to, going to school, you get this shared framework and you get to see the world the way that other people are seeing it too. And so I think uh, the layers, as a person, personally, I would say like the layers of growing up in the Midwest, kind of in the Bible Belt, growing up working class, growing up um in at least culturally, Jewish family in a very Bible Belt Christian community where there wasn't a whole lot of representation of other traditions or other faiths or backgrounds. Um, Growing up uh super closeted queer person also in that Bible Belt environment. There are kind of like Shakitra was saying, there's all of these other, you're kind of like muzzled or you have these blinders on to see the world in a very certain way. And I think a lot of young people have that experience, right? As you step outside of your environment, you get to grow a little bit, you get to meet people who are different than you or who grew up differently than you, and you start to realize like how rich and robust um like identity really is.
Mhm.
When it seemed like maybe there were only a few ways to be before that. I also think in my work, I also did a lot of work in the anti-violence movement. I started in working in domestic violence shelter. That was my first role in the field. And immediately it became so clear to me as a super green, like I think I was 19, like, very, very green in the field, um, that all of these identities not just impact the way that people experience violence, but also the way that they access care and support in their community, if they are able to do that. Um, and seeing the different paths that folks take or that folks have available to them, to safety, to healing, to recovery, to care, and to community, from a place of isolation and alienation and violence. I feel like I'm getting off track now, so I'm gonna pass to just someone else before I stay on my soapbox for too long.
I'm loving your soapbox. Ethan, you also started at like a similar age. Your own activism journey started really young. How has intersectionality shaped your journey as a person and a professional as well?
Yeah, thank you. I was thinking that too. Yeah, I started training at a rape crisis center for a hotline role the day I started college, which like I don't recommend.
Wow.
Like I had no judgment. It was like, oh, my classes are in the day and this is at night. What could go wrong? And it just terrible decision. But yeah, I mean, it took me a while to confront this, but I think that and it's a lot of these lessons, like going back to what teacher was saying about like who gets punished and who doesn't. I think about like whose experiences of harm matter and who don't, but just that like not thinking intersectionally, I think can allow for a lot of like lateral harm within like among survivors and among advocates. And so like in my own journey, the um Joe, you gave me a great like idea about like which thing. I'm always bad at choosing which story. So thank you, Joe, for my early experiences. But yeah, so I started at a rape crisis center as a hotline volunteer and then became kind of paid staff, like $100 a month, but don't count your hours, kind of a kind of a role. And about a year and a half into doing that work, uh, came out as transgender, started using the name Ethan, and was fired from that role, like explicitly for that reason. It was 20 years ago, but I was 19 and just out of this job, and I got very kindly like scooped up by a queer domestic violence organization where I knew some staff, like some staff there had heard about what happened to me and were just like, tell Ethan to come here, like just do that. And um, that organization really viewed itself as like a social justice org that used anti-domestic violence work to further social justice. And it was really learning about their origins. Yeah. So this organization had been founded by a group of queer women who helped like launch the anti-domestic violence sector in their state, help establish all these organizations, built this huge network, and then were denied services at the agencies they had helped to found because women don't behave that way. Women don't abuse other women. The real problem of domestic violence is men being violent towards women. And so just that was one of my first like real tangible, like if we're not thinking about like sexism and homophobia and transphobia, together, um, then we open ourselves to that kind of violence. And then, later when I wound up working at a shelter, and this is what, Keitra, you were really making me think of, like there were um, two circumstances in which survivors broke confidentiality that got handled very differently. So I was taking a hotline call with someone I knew was a white woman because she'd very generously done our demographic checklist while we were trying to place her in shelter. Broke confidentiality like to someone in the room while I was on the phone. And I went to a supervisor and was like, I don't know what to do. I had accepted this person into shelter, but this just happens. And I kind of I like gave them all the information I had and was told to just let this person come in. And then not long after that, I was coming into work one day and I ran into a young like Latina woman with young kids who was just kind of walking past me. And as per protocol, she said hi to me. So I then said hi back to her. And she said, I just got kicked out. And I just kind of stood there and she said, I said what town we're in. And they said that was too much of a breach and I got kicked out. And that was nowhere near the level of confidentiality breach that this white woman had given before even coming in. But that woman got access to shelter. And this other woman who had two kids was made unhoused for a much more minor kind of thing. And so just thinking like in that sector, if the idea is like, this is setting my own particular positionality aside, if this is like a movement that's largely defined as like women helping each other out, that can really mask racism and homophobia within this space. And I'm getting soapboxy too, but there is one more example I just want to give, just in the realm of like people giving themselves a pass, which is that I've also just been to so many trainings and events where particularly my fellow white people, including sometimes I feel like especially my fellow ethnic whites, as like an Ashkenazi Jew, will use the word intersectionality as just such a cover. Like I've seen people say, okay, I love intersectionality. So to do that, I am this thing and this thing and this thing and this thing, which is first of all positionality and not at all like that's not centering like the intersecting oppressions that Black women face, right? Like that's not the vision, but will use the word intersectionality, say all of that, and just kind of absolve themselves of confronting complicity in these kinds of oppression. So yeah, that's where I've run into it.
It's interesting to think about someone getting up and saying, I love intersectionality, and then talking about themselves the entire time, as
Yes.
opposed to like
Yeah.
naming, where you are within your context, and then also opening the conversation to where other people are in the context, which I think would be a more intersectional approach, which just tells us that there's room for education, right? And like how not only we think about this issue, but also how we execute on it. In my own experience, I entered into the therapeutic process. I recovered incest memories young, which, I'm grateful for, and then entered in therapy when I was about 24. Most survivors are disclosing in their 50s. We know from at least past generations. So I was really kind of sold this idea that if I did the work, I'd get better. And if I just tried harder, I'd get better. And it took like really 15 years of paying out of pocket for therapy, trying all the different new methods that were supposed to heal me. And then a lot of independent research to learn that I'm disabled, that I'm neurodivergent, and that's so often what healing means, at least in the therapeutic spaces I was in, was to assimilate to neurotypical and able society. So, the measure of my wellness was how much I could or couldn't fit in to this society that I am not wired to fit into. So that's another example of how I'm always trying to bring disability and neurodivergent conversation into the healing spaces, to say that that healing looks different for all of us, and there isn't a one size fits all, and that self-liberation, self-autonomy is such an important part um, of collective liberation, and to let therapists especially know, or anyone who's in a caregiving role, that like we are here to accompany people into their truest selves, not to mold them into what society needs them to be in order to participate in system A, B, C, or D. So anyway, that is my own share on intersectionality. Does anyone have any thoughts or ideas that have just been inspired from others people's shares?
I I'm thinking too, Joe, coming off of just what you were saying, about realizing or coming to the place that for a lot of, mainstream healing and mental health work, like you were saying, the goal is assimilation. And I
Mhm.
think often also productivity, right?
Yep.
How much of like you can go back to work now, or you can go back and do this now, the way that everyone else does, or the way that, kind of there's this cultural expectation that folks will. I also think that, and again, I am on the record as a evangelist for therapy and mental health treatment. I love it. It has changed my life, and I wouldn't be doing any of the things that I'm doing without the accompaniment and support and care of some incredible therapists. Um, and I also think like holding two complex truths at the same time, right? Or more than two, holding a bunch of truths at the same time. That it really often um lets us as a society, I guess, and as a culture, kind of off the hook
Mm,
for um like making public spaces and communal spaces and structures um accommodating of people who are neurodivergent, of people who have experienced trauma, rather than putting the onus on those individuals to get comfortable in those spaces,
yeah.
right? Like we're not going to change our structures, so you can change.
Mhm.
You can do all this hard and expensive and time consuming and difficult, right, work to change yourself. And the world is going to keep chugging along in a way that continues to perpetuate the harm that made you do all that work in the first place.
Right. Exactly.
I think for me, Joe, while you were talking, and this is a conversation we had a few weeks ago, where my gratitude for you is even you creating a comfortable and safe place for me, as someone who's Black, female, have been harmed, and I'm a Christian, right? Because Christianity is still something in this space that can still be triggering. It can still be something that just like, hey, no, and I tell you all the time, thank you for still allowing me to be in this space and never making even me feel like, okay, there's a discrimination for that, just because a lot of what we dealt with was in that environment of religion.
Hmm.
And I was talking today to an individual on when they mentioned the nervous system and the training of it. In my mind, it's like, I don't know about this and I want to, because my culture would have never said, look at this. My culture would have pointed either to religion, or my culture is just going to point to, like, they barely are getting to a place of even pointing to therapy. So anything that looks like mental support, mental health, is like, choose God, choose God. Now I realize I'm like, hey, from when you abused from 5 to 14 and harming, and then dealt with sexual assault and abuse in the military, like there's some things going on in my body I don't understand. There's some things going on before I even think a thought that I don't understand. That it's just, yeah, yes, I am a praying woman. Yes, I am a woman of faith, and I still need understanding of what's going on with my body and my mind. And I think even myself had to point that out. Like, I don't know about this, or even when we started talking about this topic, because growing up, this would have never been discussed. It would have been like, no, it would have been taboo. Like, no, we're not talking about that. That's an excuse. That's something, it's like a curse word. So I think a lot of this I'm even learning from people who don't look like me, because I think other cultures were more accepting of mental health and even diagnosing and all that before the Black culture was.
Hmm. Um, that's such a good segue, Shakidra. You really kind of brought us into the home, right? Into like How has intersectionality impacted all of our understanding of incest specifically? And again, always inviting to speak from a personal and a professional experience. Is there someone who feels invited to share?
I could go again. I think for me, when I'm looking at it and I look at being someone who my sexual abuse started very young, very early, but growing up in an environment of low income where my mother had to be absent, right? My mother was not around, and then growing up, black, female, low income Christian household. Right. So a couple of those pillars in where the culture where family is everything, what happens in this house stays in this house, all these things that come with being black, being female, strong, independent, that's very, I believe idolized sometimes in our culture. All these things created a sense of silence. Like, one, am I even gonna be, are they gonna believe me? Two, or is it gonna be normalized? And I think, to be honest, the hurt was allowed to go so long because for me, I I felt like it would be more hurtful for it to be normalized than me to deal with it within myself.
Um, Something I was thinking about too is that just recognizing that there are, power dynamics and demographic differences within families, right? That to Keisha's point, like maybe you have room to speak about and maybe you don't, you know, like in my own family, I was in a household with three kids, but I was the only joint custody kid, which is not on the traditional list. But like, I had a very different kind of life circumstance and was not connected to the family in the same way. And the person in the family who harmed me was, an uncle who's not in the same like racial ethnic category which has always made me feel really messy around how to talk about it because I don't want to contribute to ideas that result in like over criminalization of people who are racially marginalized, right? But the other thing is that my uncle was the only person in my family who would talk to me about sexuality. And that ultimately wound up, I mean, I feel really differently about that now, and I understand that, but just that like I faced a lot of just homophobic marginalization within my own family and, was being socialized and living as a girl at the time. And that this person within my own family was able to see that and use that as part of grooming.
Ethan, you wrote an excellent book called Rape by the Numbers around research and data within the sexual violence space. And are you interested in sharing? I know we have this big data gap when it comes to incest at large, but are you interested in sharing kind of like how intersectionality relates to research and data within the sexual violence space and how that hurts or harms us as anti-incest activists?
Like, the sexual assault study, and this was not child sexual abuse, but the sexual assault study that kind of like made sexual assault or rape into something called an epidemic that got national attention, was Mary Koss and colleagues, and I love and respect her work, but Mary Koss and colleagues study that came out in 1987 that gave us 1 in 4, right? Where 1 in 4 women have experienced completed or attempted rape by college, right? And in that study, they asked women about their experiences of being assaulted by men and men about their experiences assaulting women, which already gives us a huge limitation, right? So you're only learning about that one direction. But one of the things that stood out to me even more was that they asked questions about other demographics. Like, so, there were religious affiliation questions, there was a race question in there. And in the findings, there were huge racial disparities in reported sexual assault experiences. I think about 40%, for example, of Indigenous participants reported sexual assault. But in the findings and the press coverage afterwards, the entire conversation was about gender and gender only. And so, I get to Kiki's point, it's not even just like we had these ideas before, but like we've sometimes had the data and then we just walk away from it. It's like glossed over in a sentence. And then we tell the story that we wanted to tell, which is a gender story. in a project that, is white led, basically where you have researchers who are not necessarily thinking in terms of race.
One of the things that I really love about being an anti-incest activist and a neurodivergent person, because at least my neurodivergence is like, I just want to do everything all the time, right? And so there is this sense that intersectionality is a really great both, framework and methodology for activism in that it allows us to hold so much. But really, all it's asking us to hold is reality as it actually is, as opposed to reality being reduced or filtered through like someone else's experience that isn't other people's experience. Um, but that incest really does exist at the intersections of so many other social issues. And so if you're doing anti-incest activism, you're also doing so much other types of anti-oppression work, which is just so exciting to me, right? Like we can't solve incest if we don't solve ableism and racism and transphobia and xenophobia and homophobia and all these other things, because all the, incest is going to exist in any culture where those other things exist. Yeah, I know in the Alliance, and in general, as an activist, I'm always trying to teach people, especially with incest, is to just first and foremost, like before you start even thinking about solutions, let's just hold the complexity together, And sometimes that's learning to hold the complexity of your own story. And then that's entering into a community where you're learning to hold the complexity of other people's stories who grew up really different than you, right? Who exist within different intersections than you.
When you said that, it made me think about a conversation we had many, many years ago that brought so much perspective. So much of society, when they speak of my culture, is like low income, hood, violence, drugs. But then I got to see, like, hold on, middle class and upper class, different culture is dealing with what I went through too. So it's not just socioeconomic. It's not just my race. It's not just my gender. It's what is happening in multiple races, multiple genders, multiple socioeconomic groups, but same problem.
Kiki, do you have any follow-up thoughts?
I think we have to hold and grapple with this like big complexity that family is often and home is often the safest and least safe place. And sometimes it's both
Mhm.
for the same person.
Mhm.
Sometimes home is where they want to be, right? And sometimes home is where someone is really getting hurt.
Mhm.
And I think like the example that you shared, Ethan, that like this person who was able to offer something that no one else could give you also use that to harm. Like that is such a complex, like that is it's so hard to hold, and I think it's so real for so many people. Um, and I think we do such a disservice to kids, I mean to everyone, to young people, to everyone, by assuming that family and home is one thing. Um, and like it's way harder, individually and like culturally to hold this like really gray idea that everyone's experience in their family is different. And the place where I live, there um is a lot. I mean, I don't think this is necessarily unique to my community, but there's a lot of taboo around talking to young people around sexual health and sexuality. And like we could point to all sorts of things. We can point to people's lived experiences. We can point to literature and research and say, we know that teaching young people about their bodies, about sexuality, having conversations with them, letting them ask questions is such a protective factor. Not just against sexual abuse, but against like abuse and unhealthy relationships across the lifespan. And it's such a protective factor in like getting comfortable and learning about yourself and your identity. Like there's so much beauty in that and having that experience as a young person. Um, and it's so heavily politicized, that we are just setting young people up to be confused and lost and unfortunately hurt and harmed
Mhm.
in really significant ways.
Just in closing, I would love to hear how does everyone hold intersectionality in their life and in their work? Um, just as models, as people are learning about intersectionality and learning how to integrate it and execute it in their own lives.
I think for me along those lines is like being educated by those that are different than I am, that look different, that sound different, that talk different, and empathizing in a way that brings me understanding as well, like looking out of the eyes of the people that are in front of me and not just looking out of my own.
I love that so much. I feel that, curiosity is just such a great way to approach life in general. And I think kind of coupling it with consent is also really important, in the sense of when we are thinking about how we want to learn an answer to something we don't know, how do we source that information? And how do we ensure that we're sourcing that information from people who want to be sourced from, wants to be the educator? And so in that case, I can learn from books, I can learn from the internet, I can learn from other liberation or activism movements, right? Like there's ways you can access information.
I have a toddler who's really in the um question asking phase. So everything is like, what is that? Where did that come from? Why is that here? Why do they do that? Why are they doing that? What's that person doing? It's been helpful to think about like how how do I want to orient this young person's growing brain to the world to see all of these complexities and to be curious and to enjoy all of the ways that people are different and unique. And
The other thing that I really try to do, especially as an organizer, is to amplify the narratives and the experiences and the people who aren't as easily amplified in this space. So one of the people who very sadly couldn't join us today, Dr. Amira Trevino, she's one of the first people to do research on multiracial and ethnic survivors. And that's really new research, not just thinking about populations as monoracial.
The way that I've started thinking about this in more recent years is like actively decentering myself in the work, um, which has become easier for me now. So my full-time job is at an anti-trafficking organization, and I'm a survivor of sexual and intimate partner violence, but not trafficking. So I remember thinking like the first thing I need to do is recognize I'm no longer in the survivor population. And I now look back on my other work and think like I probably should have approached that work the way I'm doing this now. But just and so that doesn't mean I don't have a voice that matters or anything to contribute, but that I need to just be like constantly like listening and learning from other people whose experiences like may or may not connect with mine, but just making sure I'm like in community, but that like no one has like the center, but like particularly not me.
Well, thank you all so much for being here. It was such a pleasure to have a conversation with you. I wish we could do this in person. One day we will. And until then, always such a great experience learning from you all.